exercise is the pelvic clock. You can do it with the body disc if you'd like. You can do it without. So there's a couple different ways that you can teach this. One is literally just putting your hands on the pelvis and rolling them up and down, going this is 12 o'clock, this is 6 o'clock, 12 o'clock, 6 o'clock, now here's 1 o'clock, 1 o'clock, 7 o'clock, 1 o'clock, 7, and actually doing the motion with them. That's actually my favorite way, as opposed to telling them, okay, so now what we're going to do is have you move your pelvis, and then you're staring down essentially at their crotch and asking them to move it, which can be A, very inappropriate, and B, very intimidating for patients. So what we really want to do is be facing the patient, like so, blocking the view to their groin with your arm, and that makes it that much more appropriate. Clearly, you also don't want to be doing this. Okay, so now what we're going to be doing is, because now again, you're right in their line of sight and right into their intimate space, and that's not where you want to be. It's maybe where you want to be, it's where you shouldn't be. And if you do want to be there, you need to come talk to me, because then we'll transfer you to some other client. So idea here is that we are looking at the pelvis and its ability to move in all these different numbers, right? The biggest problem that I'm seeing is that patients are using their glutes and their hamstrings to do this motion, not even lifting up so much, but just using that to drive that, and their stomach, and using their stomach isn't actually activating it all. So you can get yourself to do a 2 o'clock without using your core at all, okay? So again, this is where those compensations are really key. You want to make sure that you're having them relax the hamstrings the first time, right? So they'll be excited. Relax the hamstrings, and you want to pull up using the core muscles, right? Now here's the other thing. When they're going down to, say, 7 o'clock or 5 o'clock, you don't want them to just go back down to center. You want them to actually roll so that they go into lumbar extension. Okay? The idea to use pelvic clocks is twofold. Number one, you can do it for range of motion. Number two, you do it for stabilization. So if you're doing it for range of motion, you really do want them to be able to lengthen into whatever range they have available to them. There we go. Or like so. Or if you're looking at the stabilization, you're looking at how do these muscles, not how do these muscles activate. Okay? So we're looking at, let's go to 6 o'clock and think about lengthening these guys down, but still being in control. Good. Now these guys pull right back up. Nope, not the buns. Just tiny. There you go. Tiny bit. Let your buns relax. There it is. Let these lengthen down. Good. Let them come up. Now we're going to go down to that side. Lengthen down. Golly. And Matt's really, really good at doing these. Most of your patients are really going to struggle. And in particular, if they've got back pain or SI pain, there's going to be one side that they can barely move on because they don't know how to control it. Okay? So my idea here for you is that know that you can do this exercise, the pelvic clocks, for range of motion and improving their ability to flex and extend at their lumbar spine. It's also used for control. If you want it to be more aggressive, then we use the body disc. And we're going to put that, boom, straight underneath here at the sacrum. And this just gives him even better ability to lengthen into that extension piece, and it gives him something to fall off of, and gravity can help pull down at those vertebrae that are just above the diamond disc, or the body disc. Okay? There we go.